CBS News medical contributor Dr. Celine Gounder. She is also editor-at-large for public health at KFF. Good morning.
Good morning.
It's good to have you. Deion Sanders had no warning signs of his bladder cancer. In fact, it was caught during scans for an unrelated medical condition. Is that typical for bladder cancer?
Not usually. Most bladder cancers are picked up when people have blood in the urine, which is the hallmark symptom of bladder cancer. Now, early cancers can be silent, as in the case of Sanders, which is why the scans he had for unrelated reasons saved his life. But although Sanders' surgeon says the cancer was high grade, because it did not invade the muscle around the bladder, they are saying the surgical removal of the bladder was curative. He is cured.
So Celine, Nate pointed out something that was interesting to me, which is that oftentimes we hear about these high-profile cases of people who just discover that they have this very serious condition. How important is it for men and women to get checked for these types of cancers, all types of cancers, on a regular and consistent basis?
Well, I know if Gayle were here, she would say, I want to be tested, screened for all the things. The problem is we don't have great screening tests for everything. So for breast cancer, colon cancer, we have great screening tests. For bladder cancer, we don't. And so this is the kind of thing that researchers are still trying to figure out. In fact, we've made some great advancements in terms of treatment as a result of the research that's been done in terms of surgery, immunotherapy. But diagnosis is a place where we actually need to do more research. And unfortunately, the NIH, the National Cancer Institute, are facing a 40% budget cut in the coming year. So that kind of advancement is going to be slowed.
So, there was a lot of discussion around the word cure yesterday when this news came out. What makes this a cure, and how is that different from, remission?
Well, based on what we are being told, again, there is no invasion of the cancer into the muscle around the bladder.
So it hasn't spread.
So when they do this kind of surgery, they will send the tissue to pathology, see if there's been spread. Can you miss microscopic spots? Yes, it is certainly possible. But based on what we have seen, what we've been told, there was no cancer into the muscle, and so therefore removal of the bladder is curative.
It's blowing my mind, a complete removal. Are they saying they're making him a new bladder?
They did. They made him a new bladder. And,
I don't know how to wrap my mind around it.
And using a piece of intestine. Now, the thing is, it is hooked up to the kidneys, to the ureters, urethra, so you can release your urine normally, but you don't have the nerves that you had with your native bladder,
so that's
your
what he
original
was
bladder.
saying about the
Yep,
nerves,
so that's why you don't
knowing
have
when to go and how to
control.
go.
Yeah, you don't have control the way you would have with a normal bladder. So you have to learn how to bear down, basically, to empty your bladder.
Oh, okay. What he was saying is making sense now.
About not having as much control.
Yeah.
Wow, Dr. Gounder, thank you.